Good morning, everybody. Welcome to MedWell Unscripted, live Florida style. We're so excited to be here. Happy December. We're in our final month of the year, and we have such a great topic today. We're talking about understanding the organics of medical marijuana. First, I want to give a shout out and also talk about a little bit of housekeeping. If you are catching the recording, please do leave a comment or a question in the feed. We're happy to answer it after. We are live streaming to Facebook and YouTube. We have our amazing Kayla from our MedWell team answering questions along the way. And be sure to ask your questions as we get going, because we want to make sure that we answer all those questions that you leave our office or a dispensary, Vidcann, and have questions. So please feel free to drop questions along the way. We are here to support you. All right, so getting started. And my name is April, by the way. I meant to introduce myself first off. And I'd like to introduce to you Nicole Stewart, who is our Director of Community Outreach here at MedWell. Good morning, Nicole.
Good morning.
And we have our friend Matt Andrus, the Dispensary Manager at Vidcann. Good morning, Matt. How are you?
Wonderful. Good morning.
All right, so let's get started with just some introductions. I want to both of you to share your roles and what you're doing to support our community. And I'm going to start with you, Nicole. Share a little bit about your position here at MedWell.
Sure, I'd be happy to do so. So my position in the community is one, to speak with potential patients, providing educational seminars or consultations that are different ways and to treat your ailments using cannabis. Some of those medications are pretty unhealthy. So as many people as I could talk to, I can, and get them on the path to an alternative healthcare. And education is key. I go out into the community, speak to as many people as I can. And I meet with local dispensaries and work together with them to provide this amazing plant and the medicine to the patients.
Awesome. And I know that you and Matt have met before, and you are doing some amazing things working together. And Matt, why don't you share a little bit about your role as a dispensary manager at Vidcann?
Well, as a dispensary manager at Vidcann, we one is going to be to educate our staff and make sure that they're up to date on as much as possible as we can on the education of cannabis to help the patients. But two is, like Nicole said, getting out in the community and making people aware of this plant and the benefits that it has and how we can help those people. It's pretty hard to do this time of year, of course, with all the COVID stuff. But Nicole and I have been able to do some things together in the past and hopefully more in the future. And we can get out there and get the word out.
Awesome. All right, so let's kind of get started about today's topic. We're talking about understanding the organics of medical marijuana. And Matt, can you kind of tell us a little bit about the difference between organic and non-organic cannabis? Because I think that, and I kind of think about it from the perspective that there's people out there that are using marijuana that don't have their medical card, and kind of the things that could possibly potentially be in that cannabis. And then we have our dispensaries that are helping with, the medical side of things, and kind of what's the difference between organic and non-organic?
Yeah, I can. Can you hear me okay? I've just got a lot of feedback on that.
I can hear you okay. You're a little bit low, but I can hear you okay. I'm not hearing feedback. It could be because I'm not. It's on your side. I don't know if you're hearing feedback.
Everything's good. So.
Okay.
The difference between organic and non-organic, I would say with the organic, it's no different than food. If you think about food and intaking food that's been sprayed with a bunch of chemicals and things like that and bringing that into our body, it's just not healthy. And it goes the same with cannabis. When you talk about cannabis and organic, we can only follow organic practices. This drug is still a scheduled drug. And until it comes off of that, we won't be able to be certified as an organic company. But we follow all those practices. And the day it comes off, we invite them to come and check us out and make us completely certified to it. But as far as growing organically, we don't use any chemicals. We don't use anything like that. Everything we do is all organic. We feed the plants good bugs to fight off the bad bugs. So we use these very beneficial bugs to help attack anything that might be attacking the plant.
Interesting. And kind of, is there a difference on how the cannabis is grown? You know, kind of from the inside perspective, is it grown any differently?
Grown differently, no, other than the different nutrients that we use as opposed to what someone else might use. All the nutrients we use are going to be organic nutrients. The way we grow, though, is a little bit different. We don't grow inside a building under all of the lights and what have you that a lot of others do. We grow in an ACE cultivation building, which is kind of like a greenhouse, except for it's been amped up, if you will. So we can take the roof off and we can let the sunlight open up, shine onto the plants, which is going to be very beneficial to help pull out more of the terpenes and more of the cannabinoids than if it was grown indoors under fake lights.
Interesting. And so can you talk a little bit about kind of the Vidcann process and how you guys grow flower?
Yeah, I mean, we grow it pretty much no differently than anybody else. We don't grow hydroponically, but we do grow in, like I said, in those ACE facilities. And it's as far as the cultivation end, that was really be a question more towards our head of cultivation for exactly how we grow it. But it's not much different. Right now, we currently clone our plants. So we do clone the plants to make the new babies and then create all our new plants. But we are opening up a tissue culture lab inside of our facility. There aren't really many tissue culture labs here in Florida for cannabis. So we've had to reach out to a special company to help us really learn the process with cannabis and make sure that we're doing it the best way possible. And we'll have one of those on site in our location in Jacksonville. So we'll be going all tissue culture.
So can you talk a little bit more about that? So that's interesting. I've never heard that term before. I learned something new all the time. So tell us a little bit about that process and what that means. So yeah, sure.
Yeah, I can explain to you the best way I can. I'm not an expert on this by no means. And again, that'd be more for people in our cultivation. I can just kind of tell you what's been passed down to me in regards to tissue culture and what I've looked at and read. Basically, when people grow cannabis, mostly they clone the cannabis. In other words, they just cut the top off the plant, stick it in the dirt, and it grows again. So, they call it a weed. It grows like a weed. You just cut the top off and stick it in the dirt, and it grows. And you have the mother plant that you have to take care of, which is going to bring out all her babies and get you the best cannabis. So the problem is when you keep cloning, you can keep breaking down the plant. And the more you clone and the more you break down, the more you clone, the more you break down, you can hinder the plant. And so with tissue culture, you're pretty much starting with a new one every time. Yeah. So you keep that mother plant as strong as possible.
And so when you clone a plant, does it kind of change its potency?
There are some thoughts that the potency could be diluted a little bit, but as long as the mother plant is kept strong, and then you should be fine there. But that is a thought that it could be diluted. But honestly, the majority of people clone their plants. Probably 99% of the cannabis that's grown is cloned, which is pretty amazing to think that you start with one seed and it grows, and then you just keep cutting the top off and adding plants. Interesting.
And how? So, and I know that you're not the cultivation person personally growing it, but how does it? So when you go from a seed, how does kind of that hybrid plant kind of come to be and being able to clone that?
Well, they're gonna that's gonna be definitely some stuff for cultivation more than me, for sure.
All right, that's what I thought. And so sorry, and my juices started thinking I'm thinking of the whole behind the scenes of how things happen, and so awesome. Thank you. So let's talk a little bit about kind of the health benefits of cannabis and how it helps. So at MedWell, clearly our role is to help people find to get through their certification process and help ease their pain. But can you talk a little bit about kind of the health benefits that come from using medical cannabis?
We don't have enough time, to be honest with you. It's unbelievable how much of health benefits there are for cannabis. I was completely shocked when I got into this industry and started to learn more and more about it. It's unbelievable. I was just actually, while we were waiting for the thing to begin, looking at the Tikkun website and noticing some more benefits on MS and studies with MS that they've been doing over in Israel with CBD products. I mean, it's just the sad part is it's not studied enough here in the United States because it's federally illegal, obviously. But we are partnered with Tikkun Olam, which is from Israel. Tikkun Olam, which means repair the world, has been doing medical research for over 15 years over in Israel on over 20,000 patients for each one of their strains. And so we have the benefits, the studies to show exactly what benefits the cannabis can give and the relief that they can give for certain ailments like MS or autoimmune disease or Crohn's, or pain, anxiety, all sorts of things like that.
And so what are some of the products that Vidcann offers?
So we offer all of our product line. And then we also offer Tikkun Olam products from Israel. They're our elite product that we carry. And we also carry Stanley Brothers Charlotte's Web out of Colorado, a wonderful product, mostly CBD ratio. We offer products from, capsules, tinctures, vapes, creams, flour, pre-rolls, concentrates. So variety.
And can you talk a little bit about, especially because we're in these interesting pandemic times, a little bit about the patient process in if somebody comes in for the first time to Vidcann and what your offerings are? Do they meet with somebody? Can they do it by phone? How does that process work?
Yeah, so we meet with the doctor's patients all the time. Sometimes they will send them down before their card is actually live, so they can come in and do a consult with us to learn about Vidcann itself, but mainly to learn about cannabis and the benefits that it can give them, and the different ways to intake cannabis and how it's going to react in the body and things like that. So we do consults all the time with those patients that aren't even active yet. But also once they get their card, they're more than welcome to call up and set an appointment, or they just come in, and on their first visit, we try to find out with them what ailments are they dealing with and why did they get their card and how we can help them. And if it needs a consult, then we ask them to come on into our consult room and we'll sit down and do a nice one-on-one, or have their spouse or family member or what have you with them so they can listen and learn also.
And so if I were a new patient coming into Vidcann, kind of what would be, and I had questions like, so say I have MS, for example, how would that process work in kind of making sure that I find a product to try to kind of suit my needs and relieving my pain? How would that piece go?
So if you're somebody, you come in and you're talking about your pain maybe and MS and what have you, then we're going to sit down and talk about, try to get your whole day plotted out and find out what you're doing during the day. What are you doing during the evening? When is that pain brought out mostly? What's bothering you about it? Sometimes we have to fix the night to fix the day. Sometimes it's the opposite. So we really need to really truly find out what is going on with that person. Sometimes it's just getting better rest. And if that's the case, then we're going to want to get them on a nice sedating indica strain that we can get them some good rest. Sure. We always start the dose low and slow and teach them the process, and we give them the recommended starting time. A lot of folks don't realize that the body really starts to feel the effects of THC at about 2.5 to 3 milligrams. And some people dive right in at 10 milligrams and it's not needed at all. So we discuss those things, and then something like MS, we would certainly talk about the benefits of the CBD and the studies that have been shown with things like the Avodeco strain from Tikkun Olam. High CBD strains, low THC, no psychoactive effect that they could take, go to work or teach or deal with the kids and not have to worry about that THC.
Interesting. And do you offer any discounts or anything for patients? Do you have any programs that you offer?
Yeah, as a first-time patient, you get $55 off 100. So once you reach the $100 mark, you get $55 off. And after that point, you'll be put into our points reward system, where you gain 1.5 points for every dollar you spend, which gathers up quickly. And at $250, $500, and 1,000, you get certain points dollars off. And then pretty much almost every other day, we're running a special. So like today, we sent out a text and email regarding a buy two, get one free pre-roll, 15% off all Tikkun Olam tinctures. Some days it's buy two, get one free flour, or 30% off a jar, or vapes 15. It varies. So pretty much we do about I'll be honest with you, probably 3 to 5 days a week we're running a special.
Great, great. You know what, Nicole, I'd love for you to share a little bit about kind of the certification process and kind of the handoff to Vidcann, so people can understand kind of how that works, especially where Matt went over kind of what the patient experience is on their end. I think it'd be helpful how we're working with patients during COVID, because we have in-office as well as telemed appointments available right now.
Exactly. So we do a mix. It's probably equal. A lot of telehealth versus in-house. So what's great being neighbors with Vidcann in Bradenton is that when I have a new patient walk in, of course, we're masked, and we ask the same for patients to be masked with COVID. And once we show them how we get through the certification process, which basically is not a very difficult process when you see the doctor, it's very comfortable, relaxed. And I always like to walk the patients down to Vidcann, especially when they're new and they just make an appointment with us, so they can get a head start before their appointment, and they actually get their card in the mail that they're familiar with the Tycoon product. I'm a huge supporter of Tycoon. I'm a user of Tycoon, and I think it's one of the best. So I always aim my patients to go down there, because I know that Vidcann gives amazing education, consultations, and when they leave, they always come back and they're very impressed. The staff over there is wonderful. So once they get certified with us, then, obviously we hand them off down and get to show the products over at Vidcann. So that's what we do.
Awesome. Awesome. So Matt, kind of as we wrap up, can you just kind of share with our audience, what you'd really like people to know that sets you apart at Vidcann, as opposed to, and also your location. So what sets you apart from others, and why, especially from that organic piece? I know your whole process is a lot different than other places, so I'm going to let you take it away.
No problem. One thing I did want to mention about the discounts, I didn't even mention, we give veterans 15% off, also pediatrics, and also industry discounts too. But I think what sets us aside is, one, we're not just here to push, the street recreational people, jars of cannabis. We're here to help patients and people with issues. And we educate our staff so that they can explain what they need to explain to the doctor's patients, so they can get that education that they need. So usually in every one of our Vidcann stores, there's at least 2 to 3 people that are going to be very helpful and knowledgeable in that, so they can help those patients. And we're going to take the time to take care of you. We don't try to get you in and out the door. I have people all the time that come from other dispensaries and dump stuff on the counter and say, "What is this? They told me to take this. I don't even know what it is." And then, they start talking about their ailments, and it isn't even close to what they needed to take. So that's very disappointing that happens out there, but I'm not saying that that's where everyone does it, but, that does happen.
Sure.
Because some people just aren't educated in those stores, and they're just, they're retail people. And, we pride ourselves to make sure that our folks are knowledgeable in what they do. And we pay attention and listen, and we just hire great people to take care of our customers. Those patients of the doctors that come in here, they need help. We do have a large portion of recreational people, obviously, but the ones that are true medicinal, this is the place for them to come to really get that experience that they need.
Absolutely. I love that. And I love, how you use the word education and customer experience, because at MedWell, that's the heart of our business. We always want to provide customer excellence to our patients, as well as educating our clients on what's going on in the cannabis world. And that's why we do MedWell Unscripted, to share information and education on cannabis and what's happening, so people better understand. Because I think one of the challenges can be, especially kind of in the older demographic, is that they don't know what questions to ask. There's some confusion on, where do I start? What questions do I ask? And there's also, I think that although there's much less of a stigma nowadays, there is a little bit of a stigma, and people are worried what people will think if they're asking these questions. So I love that you're a partner of ours that has the same heart and soul belief system that we do. So our friend Jonathan's asking, what I have found unique about my experience at Vidcann has been their consultative approach. Actually, it's not a question, it's a comment. So awesome. All right. Well, I really appreciate your time today, Matt. Thank you so much for telling us the kind of the organic elements of the cannabis process. I think it's, again, one of those questions that's a dynamic that people don't necessarily understand, and kind of the testing. And I'll be interested to learn more down the road about the tissue piece that you're adding. And kind of that's an interesting, and maybe we can have one of your growers on a future show to talk a little bit more about that.
Yeah, that'd be great.
And then,
those testing aspect of it too. I didn't even mention, we test all our products before we send it out to third-party analytical, which is something we have always done. We've always used third-party analytical. Many dispensaries weren't prior, and they're now, it's mandatory that they do. The state has changed that. But when we do our testing, we don't just test for those pesticides and things like that to make sure nothing got into our cultivation. We also test for heavy metals and other things like that are going to be non-beneficial to a person. So as organic as we can be, like I said, think about it like your food. You don't want all those pesticides going into your body, all those GMOs, and, things like that. You're better off getting something that hasn't been sprayed.
exactly. Now, Matt, excuse me, I just want to ask one question. You still do delivery, correct? You can deliver?
We do. Yes, we do. Thanks, Nicole. We deliver Monday, Wednesday, and Friday at this location. All of our locations deliver. There's a delivery fee of $20, but don't let that fool you, because if the bill is over $75, the delivery is waived. So anything over $75 is going to be free. And we deliver within an hour of all Vidcans. So
that's huge.
Almost about the center of the state's about the only place we can't get to. But yeah, we can go anywhere. It's easy. It's simple. It's almost like that Domino's commercial. Anywhere you are, as long as it's to you.
Awesome. Well, thank you again so much, Nicole and Matt, for your time today. Thank you, Kayla, for helping us in the chat. And thank you, everybody, for coming today. Again, if you're catching the replay, feel free to leave a comment or a question. We'll be sure to get back to you. And for all of your medical certification needs, please stop by our website at medwellhealth.net. We offer in-person as well as telemed appointments. Or if you just have a question about kind of the process and getting started, please do stop by our website and give us a call. We're here to help you. All right. Thank you so much, everybody. Have a wonderful day. And I will look forward to MedWell Unscripted Florida Style in 2 weeks.
Thank you.